Good afternoon. Thank you for joining the Voices for Healthy Kids webinar for applicants on the topic of health equity. Voices for Healthy Kids is committed to creating health equity through our campaigns and policies. It is a core value of ours, and so we want to ensure that all of our grantees and partners are aligned in this goal. The purpose of this webinar is to provide you with some information about our health equity vision, approach, and expectations to help inform your proposal. I would like to read our health equity vision statement to help ground this conversation. Voices for Healthy Kids is deeply committed to health equity through changes in public policy that address barriers to health, including racism and oppression within systems, which disproportionately burden people who are socially and/or economically disadvantaged. We use the science-based strategies of the American Heart Association and expert advisory groups to guide our policy and decision-making. By changing laws to achieve equity in public policy, we believe all people can have better opportunities to access wholesome foods and to be active, which can lead to making optimal health a possibility for everyone. Now, we recognize that each organization may have a different approach or different definition to health equity. We welcome hearing more about your approach and the alignment with ours in your proposal. We want to provide you with some high-level values that Voices for Healthy Kids believes makes a successful and equitable campaign. It is up to you to determine the best way to incorporate these values in your campaign plan and grant proposal. First, a participatory approach. It is one in which everyone who has a stake in the policy has a voice and a role in the campaign. We fully believe that the most impactful campaigns and the best implemented policies are those that take a participatory approach and include the community members, organizations, and businesses that will be most impacted by the policy. Second, inclusive of communities most impacted. To take the participatory approach one step further, we also believe that an intentional inclusion of communities most impacted or most vulnerable in the is required in the campaign planning process and implementation. Engagement of these communities is key to the development of a policy that reduces disparities and, most importantly, is embraced by those it is intended to serve. Third, reduce disparities for priority populations. Voices for Healthy Kids has identified 3 priority populations: people of color, specifically Black and Latinx, Native Americans, and rural communities. A specific effort should be made to design campaigns and policies that address barriers to health for one or all of these priority populations. While our policies are designed to increase health for all populations, we do have a specific focus on removing barriers and creating pathways to health for these priority populations. These populations have been identified as priorities for Voices for Healthy Kids and in an effort to eliminate disparities in health outcomes. 4. Subgrantees and partnerships. We require and highly encourage all applicants to identify subgrantees or partners that diversify their team. Our goal is to have comprehensive and diverse campaigns. Therefore, if you are a minority-led organization, we encourage you to find partners that represent other communities impacted by the issue area. If you are a majority-led organization, we encourage you to find partners that are led by or represent communities most impacted by your policy. 5. Diverse coalitions. In addition to having a diverse grant team, we highly encourage diversity amongst your coalitions. Often, well-funded, majority-led, popular organizations and leaders are included in coalitions. While we encourage you to include these groups, we also encourage you to include all of the different stakeholders that will be impacted by the policy. These can include priority populations, communities of color, disabilities community, and other marginalized communities. This could also include other diverse groups that can help your campaign to be successful. As you can see, there is a common bridge through each of these 5 values. In order to create policies that are implemented in a way that reduces the disparities in health outcomes for priority populations, we must ensure these populations are included in the campaign through partnerships, coalitions, and a participatory approach. While we won't be too prescriptive on how to incorporate these health equity values and goals in your proposal, we can say that we encourage you to incorporate it throughout your entire proposal. We firmly believe that health equity is not just an add-on or a checkbox. It is an intentional action, strategies, and goals within your entire proposal. Different areas that health equity values and concepts can be incorporated in your proposal include within your timeline, budget, approach, strategies, partnerships, coalitions, within your communication plan, and policy goals. Thank you for joining us today as we walked through the Voices for Healthy Kids health equity values and approach to inclusion in your proposals. If you have any additional questions, please feel free to reach out to Shannon Maluza at shannon.maluzo@heart.org. Thank you very much.